Thank you very much, everyone, especially you, Ulrich, for understanding that this time I must be remote. Being qualified for the Ironman World Championship here in Hawaii is a dream that came true and now is involving all of you. That's really amazing. The title of my presentation is Digital Implantologists' Impact on Chronic Disease Management. Every time I'm preparing something on chronic disease, I am surprised by the numbers. So let's get started with some global facts. In the United States, regardless race or socioeconomic factors, half of the population will experience one chronic disease by age 65. This number goes up with age, reaching an 85% chance of an 80-year-old to develop more than one chronic disease. The most common chronic diseases include diabetes, heart disease, strokes, mental conditions, not excluding asthma, arthritis, multiple sclerosis. In Europe, 1 in 4 people has a chronic condition affecting their daily activity and productivity. Treatment and management of these chronic conditions have a huge impact in our health system, directing 70 to 80% of the expenditures, amounting to 700 billion euros per year. We know the causes of chronic diseases, for instance, infections, sedentary lifestyle, obesity, intestinal dysbiosis, stress, poor sleep quality, all leading to chronic inflammation and the consequences of the chronic diseases I described earlier, and aging. As much as our understanding on the causes involved, so we have realized that reducing risk factors is key to prevention. Nowadays, only 3% of the health budget goes to prevention, so how can we invest better? Digitalization helps us to use knowledge from all around the world, enabling us to exchange good practices with positive outcomes and preparing us to work together in an integrated care. On one side, you have the better management of chronic diseases. On the other side, you ensure your patient a healthy aging, tied together to prevention. Since chronic diseases are defined as a non-viral pathology that lasts more than 3 months and then cannot be cured by medication, prevention and digital transformation help us to personalize care, identify lifestyles that are related to disease, as well as propose effective treatment. For instance, eliminate FTOJ, peri-implantitis related to titanium implants, infections associated with root-treated teeth, and which are oral cofactors of systemic chronic diseases. And this is how I introduce to you investment in prevention. Is the replacement with ceramic implants. Here you see the results of a recent clinical study conducted at SWISS BIOHEALTH CLINIC. All the patients underwent the all-in-one treatment where root-treated teeth associated with infection, titanium implants, and committed teeth were replaced with ceramic implants. Here, Swiss Dental Solutions implants. The patients were followed for more one year, and we assessed the autonomic nervous system activity, determining values such as heart frequency, the red bar sympathetic activity, the blue bar, parasympathetic activity before and after surgery. Note that after surgery, there is a reduction on the sympathetic activity, red bar, and an increase of the blue bar, parasympathetic activity, consistently. In other words, that means a balance of the autonomic nervous system, which enhances the immune system ability to regenerate and to heal. We also accessed inflammatory biomarkers, and here you see the classic cytokines that are released from leukocytes during an inflammatory process. Note that all of them reduced after surgery with significant reduction for interleukin-1 beta, reactive protein C, and interleukin 10, with an expected increase for interferon gamma, which means a normal response of immune system to surgery trauma. Then we ask the question, were titanium implants associated with peri-implantitis, root channel treated teeth associated with infection, ill-fitting metal crowns and amalgam restorations, compromised teeth, correlated with the high levels of CRP and interleukin-1 beta before surgery. Linear regression show us that ill-fitting metal crowns and amalgam restorations could be correlated with the high levels of CRP and interleukin-1 beta before surgery, as the presence of root canal treated teeth correlated with the high levels of CRP. We also assessed immune aging parameters such as telomere length and mitochondria function. Note that both parameters increased after surgery. Then we ask the question, can ceramic implants be correlated with this improvement? Linear regression show us that the placement of ceramic implants could be correlated with a better mitochondrial performance. To study the whole of digital transformation on preventing chronic diseases, we are conducting a new study, and here are 3 of the digital planet cases. In the first case, we proceeded with an external sinus lift, bone augmentation, and placement of sinus implants. Virtual recording of the jaw movement helped us to create a 3D smile design, implant plan, virtual walks of the definitive crowns help us to plan the implant position from the position of the definitive crowns. The guides were printed, and in this case, the patient returned 4 months later when we removed the cage. Right from the start, the patient showed very favorable inflammatory parameters as well as telomere length, despite of impairment on mitochondrial function. In the second case, the patient received ceramic implants on static demanding area. DICOM and STL segmentation integrated with a planning software help us to visualize tooth extraction as well as alveolar conditions. Then we planned the crowns, a definitive view, implant plan, guide plan, implant position from the definitive crown position. The guide was printed, enabling a precise implantation. From the beginning, the patient showed also very favorable inflammatory biomarkers, as well as telomere length, although an impairment on mitochondrial function. In the third case, the patient received many ceramic implants, a complex case. And here I show the plan where he had a bridge. Virtual occlusion coupled with the 3D scan and walks up help us on the implant plan, guide plan, occlusal view. The guide was printed, enabling the precise implantation of all implants at once. In this case, the patient had very poor quality, health quality, showing high levels of inflammatory biomarkers, as well as a shortened telomere length and impairment of the mitochondria function. These patients and all the patients will be followed for 1 more year, and the outcomes as implant positioning related to marginal bone level, survival and success, inflammatory biomarkers, and immune aging will be assessed. The question remains open. Can guided surgery outcomes benefit inflammatory biomarkers and aging? What we can state by now is that inflammatory biomarkers and healthy aging improved in all-in-one patients. Freehand surgery may result in unfavorable implant placement, especially in complex cases. Digital technology enhances implant placement precision, and that's a boost for implant immediate loading implantation, as well as bone augmentation technique. Overall, improving overall the treatment success. And that brings the patient back to their daily activity, reducing costs and preventing chronic diseases. And of course, we don't stop by here, we go further for definitive conclusions. Thank you very much for your attention.